Omicron appears to have peaked in Singapore, and according to Health Minister Ong Ye Kung, the wave is subsiding. Connecting the north to the city, 11 more stations along the Thomson East Coast Line will open later this year. And Hong Kong will now focus on protecting the lives of elderly as its COVID-19 death toll keeps on climbing. Good evening, you're watching The Big Story with me, Hairianto Diman. Subscribe to the Straits Times channel so you will not miss a single episode. It's taken a while, but Singapore seems to have weathered the Omicron wave. Here's Health Minister Ong Ye Kung speaking in Parliament this afternoon during the debate on the Health Ministry's budget.
There are now good indications that the Omicron transmission wave has peaked and starting to subside. With that, I hope not too long from now, healthcare workers will finally have a well-deserved and lasting respite. The men and women of the healthcare sector, they are brave, dedicated, committed, big-hearted, professional, and they deserve all the support, respect, and understanding that we can give.
Now, what could this mean? Well, back on February 14th, in a written parliamentary reply, Mr. Ong had said that once the Omicron wave peaks and starts to subside, Singaporeans can look forward to an easing of safe management measures. Mr. Ong's remarks today come as Singapore's COVID-19 weekly infection growth rate remained below 1 for the 7th straight day yesterday. 22,201 total cases were reported last night, comprising 215 imported infections and the rest local. And among the local cases, about 19,300 were detected through ART, meaning they were assessed by a doctor to have mild symptoms. In a shift towards preventive medical care as opposed to reactive, from next year, the Health Ministry will be inviting each resident in Singapore to enroll with one GP or polyclinic doctor of their choice for all their care needs. Getting a primary care doctor to lead the care for patients would help prevent diseases as well as reduce or delay the likelihood of those with chronic conditions needing treatments at the hospitals. This is happening as demand from a fast-aging population will inevitably surge, and healthcare expenditure is expected to triple in the coming decade to almost 27 billion in 2030.
The measures must be taken early when the person is still healthy. We must identify the risk factors in our lives that will erode our health slowly and quietly, and then address these factors. It must be done in homes and in the community, not in hospitals or clinics. It is best centered on family doctors in polyclinics and GP clinics, and less on surgeons and specialists in hospitals. However, only 3 in 5 Singaporeans have a regular family doctor. The other 2 tend to doctor hop. Go to Dr. A for hypertension medicine. Go to Dr. B for cough and cold and get MC. So there is no one family doctor who knows our overall health condition and family health history well enough to be able to see the link between different care episodes.
Let's find out more from the Straits Times' senior health correspondent, Joyce Teo. Joyce, I see the same GP whenever I fall ill. How will my visits change with this program?
With this change, you won't be just seeing him when you're ill. So it's kind of like you'll be making regular scheduled visits. Health Minister Ong Ye Kung says that it will be at least once a year. So that allows the doctor to actually assess your overall health condition. So you don't actually go there only when you're sick, right? So he can actually conduct health screenings and then suggest maybe lifestyle changes to help you improve your health. He can even refer you to like a social service agency, or give you an exercise prescription and then get you to join, like say, a brisk walking program, So it's not like just giving you medicine for an illness.
And something that comes to mind right away, Joyce, is the logistical challenges of implementing this. Are there enough GPs, and how much will this add to their workload?
Right. So, okay, it will take some time for this to happen, right? So people will sign up for it progressively, and the MOH said that it will support the GPs in this. So, for instance, in helping them build up their clinic capabilities in telemedicine, IT systems. It's also going to help build up the workforce in the primary and community care area. So I spoke with Dr. Tan Zili. He's the president of the College of Family Physicians in Singapore, and he says that he thinks GPs can do this. Just looking at how the GPs have stepped up to help Singapore fight COVID in this Omicron wave. So it's workable, possible, and the MOH said they will support the GPs anyway. There'll be training, there'll be lots of other support as well.
And do you expect the program to result in fewer people going to the hospitals, which are considered to have better facilities and care for non-emergency cases?
If this strategy succeeds, it will result in less people needing to go to the hospital, or just generally less hospital visits. So you only go to the hospital, hopefully, only if you need, like, say, complex treatments. But as for non-emergency cases, many people go there for different reasons. Maybe they're unsure of what to do or who's there to take care of them, right? By making the GPs the focal point in this Singapore's healthcare system, it might just help shift mindset, right? Like if people think that the hospital is the best place for their care needs, which they do now, in the future, it will be your regular GP who will see to all your care needs. And you'll be the one person who actually knows you. You form a relationship with him, and you see him over a period of time. He actually understands you, and he can advise you on things to do to improve your health. Just imagine, walking down to the GP downstairs or near your house to, discuss your health. You don't have to wait a long time at the, say, hospitals. The GPs, I think, will be a lot more accessible, and it's somebody that you know.
Right, it's definitely something that we are certainly looking forward to, Joyce. Well, thank you so much for the insights. Senior Health Correspondent, Joyce Teo. People with mental health conditions will be able to get help at more locations, with the National Addictions Management Service extended to other public hospitals. Right now, this service is only based in the Institute of Mental Health.
During the pandemic, we saw an increase in the demand for mental health services. Planning has started to future-proof more hospital capacity for psychiatric services beyond the Institute of Mental Health, IMH, our main psychiatric hospital. The National University Health System will set up psychiatric services at the redeveloped Alexandra Hospital, in addition to the general hospital services that will be located there. Mental health care services need to be more accessible and delivered in many settings other than only in IMH, as well as integrated into the community and general medical services. The new unit at Alexandra Hospital and the provision of new services in other centers will increase the outreach of mental health care and improve the care of patients and support to their families. We will extend this approach to social service organizations and other partners working in the community.
Moving on to the Transport Ministry's budget debate, with the aviation sector set to get a fresh injection of $500 million to further help its recovery. This OneAviation Resilience Package has three components. $60 million will go into manpower support, like for wages. The funding for cost relief and support for public health safeguards will add up to $390 million. And $50 million for industry and workforce transformation support. Transport Minister Iswaran also says the government aims to restore Changi Airport's passenger volume to at least 50% of pre-pandemic levels. And so, Singapore needs to sustain the momentum in reopening its borders.
Today, we have VTLs with 32 countries. These VTLs have enabled us to attain passenger volumes of about 15% of pre-COVID levels in December 2021. Flights at Changi have reached 38%, and city links are at 58%. Many have finally been able to reunite with family and friends abroad. We must sustain this momentum. Other aviation hubs like Dubai, Qatar, and Istanbul are already at up to 70% of their pre-COVID international passenger traffic. In our region, Malaysia, Vietnam, Thailand, and Philippines have announced plans to reopen their borders to all vaccinated travelers. In short, the world is learning to live with COVID. We now have the confidence and opportunity to move decisively. IATA forecasts that international passenger volumes in the Asia-Pacific will recover to about 40% of pre-COVID levels this year. We aim to restore Changi's passenger volumes to be at least 50% of pre-COVID levels in 2022.
11 more stations along the Thomson East Coast Line will begin operations in the second half of this year, running from Stevens through Orchard and Outram Park to Gardens by the Bay, which means commuters will have access to areas like Great World, Maxwell and Shenton Way. This is part of the TEL Stage 3, which has 13 stations. Authorities have said the remaining 2, Mount Pleasant and Marina South, will open later after the completion of public housing developments in those areas. In other news, all lorries ferrying migrant workers will now be equipped with speed limiters and must have a designated person in the vehicle who can stop the driver if he's too tired or driving unsafely. The speed limit is not revealed as yet. The traffic police is working with the industry and more details will be released later. More escape routes are expected to open up in Ukrainian cities today for people trapped by the fighting to leave safely. This follows the launch of the first successful humanitarian corridor on Tuesday, allowing civilians and foreign students in Sumy to evacuate the besieged city. More than 2 million Ukrainians have fled their country since Russia began its invasion almost 2 weeks ago, and that number is rising. According to the UN Refugee Agency, the vast majority, more than 1.2 million, have crossed the border to Poland. The UN's atomic watchdog says it's no longer receiving data from the monitoring systems at the Chernobyl nuclear power plant, and it's worried for the Ukrainian staff working there. More than 200 technicians and guards remain trapped at the site, which was seized by Russian forces at the start of the conflict. Changi Airport Group today disclosed in an exchange filing that has an interest in several Russian airports through subsidiary Changi Airports International. CAI holds a 30% stake in a holding company in Russia, which wholly owns 3 airports in the country, as well as an indirect stake in Vladivostok Airport. In response to Singapore's previous announcement of sanctions against Russia, CAG says it will comply with all legal and regulatory obligations applicable to the group and its subsidiaries. Elsewhere, speaking for the first time in about 2 weeks, Hong Kong Chief Executive Carrie Lam says the city will switch gears and prioritize elderly lives in its fight against COVID-19. With the rising number of deaths among its under-vaccinated seniors, Mrs. Lam explains that the focus at this point should be on reducing severe cases, fatalities and the spread of the disease. She also says the mass testing exercise announced 2 weeks ago is not the top priority, and the government will roll out when it will be most effective. And Australia will declare a national emergency over the devastating floods along its east coast. This will give the federal government powers to cut red tape and deploy resources immediately, including more defence personnel. Local media reported that Prime Minister Scott Morrison will also pledge more financial support for people and businesses. Visit straitstimes.com for the latest news and our YouTube channel for more videos. Subscribe by hitting the red button below. I'm Haryanto Diman. See you tomorrow for more stories on The Big Story.